Hello, everybody. My name is Erica Johnson. I'm the Senior Vice President for Academic and Medical Affairs at the American Board of Internal Medicine. We really appreciate you joining us for our fourth Trust Conversation of 2025. This webinar series is a core element of the Foundation's Building Trust initiative. Before we begin, I'd like to go over a few logistics. The meeting's going to be recorded for the purpose of sharing with you to replay. For most of the conversation, we'll have lines muted, and that's just to reduce some unnecessary background noise. There will be a chance towards the end of our conversation today for our speakers to answer any questions that you may have. And in the spirit of being fully present and engaging and attentive listening during this conversation, I ask that you please wait until the end of our conversation to submit any questions you might have in the chat. So we're joined today by Bill Doherty, who is Professor Emeritus at the University of Minnesota and a co-founder of Braver Angels, a citizen initiative bringing conservatives and liberals together to counteract political polarization. And also Tara Montgomery, executive in residence at the Skoll Center for Social Entrepreneurship at the University of Oxford and the founder and principal of Civic Health Partners. Civic Health Partners is an independent coaching and consulting practice that helps leaders reflect on trust and develop public engagement strategies that are worthy of trust. Bill, Tara, thank you for joining us for this timely and important conversation today.
Great to be here.
It's a pleasure.
Thank you. So maybe to start us off, I'd like to ask each of you to share what motivated you to engage in work focused on building trust and bridging divides. Tara, let's start with you.
Thank you so much, Erica. Hi, everybody. Maybe because you mentioned this was a timely conversation, I just want to acknowledge the elephant in the room, which is this morning, the Supreme Court made a ruling to uphold the ban on transgender youth getting gender-affirming care in Tennessee and in the States. I think this just is so salient for me as actually a motivating factor that things like this are going on. We all have experienced or know about similar examples in our world. So this is a very real conversation. And I think it really strikes me it's not a conversation just about ideas anymore. It's about a conversation that polarization dehumanizes people. Polarization kills people. So that's a sort of a chilling way to start, but I can't help myself. But stepping back, my motivation is actually that I spent the first 2 decades of my career working on creating trustworthy information at publishing companies, academic publishing, and more recently at Consumer Reports, which is one of the most trusted brands in America. And so I really learned what the components of trust were and the positive impact that a trustworthy organization can have on health and in the world. But in about 2016, when Trump was elected, I was noticing that distrust was really permeating the dialogue in healthcare. And I decided to leave Consumer Reports and focus more on the big questions of institutional trust and the impact on health outcomes. And I can say more about all of that later, but that's my introductory statement. Thank you.
Thank you so much. Bill, I'd love to hear more about Braver Angels and the work they're doing in healthcare.
Yeah, well, so in keeping with the Tara's opening, let me just say I'm glad to be here. And also, my heart is heavy because I'm from Minnesota, where we lost 2 of our legislators to, well, one and another shot to, in a political violence episode this weekend. So it's very close to home, very close to home. And I got involved with political depolarization right after the 2016 presidential election. My background, I'm an academic and a psychologist and a marriage therapist, and I've done a lot of community engagement work. And in 2016, after Trump was elected, I got a call from 2 colleagues, one from New York City, one from Southwest Ohio, who were saying how differently people were feeling about that election. The world was ending in New York City, and it was morning in America in Southwest Ohio. And they decided to pull together 10 Hillary Clinton voters and 10 Donald Trump voters together for 13 hours over a weekend in South Lebanon, Ohio. And called me, and I said, that's pretty brave. What are we thinking of doing with them when you get them together? And they said they didn't know, but they thought I could figure that part out, which I found quite daunting. But I said yes. And so we did that weekend with that group. We thought it would be one-off, but it was very successful, and we decided to continue, start a nonprofit. And since then, we've done several thousand of these workshops. We started out really just regular lay people, and then over time, we began to have interest from elected officials and healthcare professionals. So in recent years, we've done two kinds of workshops for healthcare professionals. One is for clinicians on patient care in a time of low trust, and health and public health professionals who are dealing at a different level, of course, with the decline in trust. So that's how we're in the space of bridge building, trying to create more trust, both for professionals and also for the lay public.
Yeah. It's interesting that you were both inspired to your work. I guess in response to this feeling of increasing polarization in the communities and in the professional spaces in which you work. I so just wanted to point that out as a common thread in your stories. And Tara, I want to turn back to you to hear a bit more about your recent work. I think you were about to add some more details about that and how it connects to some of the things that Bill's talking about with Braver Angels.
Yeah, I really admire what you're doing, Bill. And I think what we certainly have in common, even though I'm working mostly at the institutional level, or at least helping institutional leaders make sense of polarization, it's about relationships, no matter what level you work at, institutional, team, system, individual, community. It's always about having dialogue with each other. And so I think the models that Bill has begun to share are going to be inspiring actually for my work. But where I've worked recently, I've worked with Doctors Without Borders. I've worked with the medical boards community. I've worked with a big food cooperative. All of them are in their own unique ways dealing with really politically fraught contexts that are kind of interfering with their mission. And I think that's where I'm interested in actually learning from Bill, but where I'm helping my clients is to make sense of the politically fraught context and whether they need to take a stand, step back, be peacemakers, um, defend their mission, allow dissent. Like there's a lot there. And it's certainly going on for anyone who's listening to this who's based in a university. I mean, the strong example is around, academic freedom and dissent and so on, and the limits now on that. So I'm helping a lot of leaders make sense of that. And I think that keeping dialogue open and having, even though it can be really challenging to your own values or your own sense of what your job was and what you signed up to do, but participating in dialogue is the only way through, with maybe with some exceptions that I'll talk about later. Um, yeah, so I think with every issue that we're dealing with in the organizations I'm working with now, two of them are having big conflicts about the Israel-Gaza situation and about how to respond in terms of, say, a boycott or whether to let people speak up. And that polarization destabilizes institutions. And then there's political interference in that dialogue that complicates that. And it's incredibly difficult for individuals in those organizations to keep doing what they come to work to do and to also kind of align their values with what is going on.
Yeah, absolutely. Thank you for all those points. And I think it really resonated with me, your comments about the importance of helping people engage in productive dialogue and build relationships as the only way through, as you put it. Um,
Could
Bill,
I just add something, having
yeah,
worked with
absolutely.
Tara, that I'm glad you brought up the variety of these institutions, because there is no institution in American life that is not experiencing this. And so we're doing healthcare, but it can be both sobering, but also, I don't know, encouraging, or I don't know what the word would be, but we're all going through this. And there are principles that are going to be becoming clear at various levels, from institutions to families, about how we get through this, because it is not just healthcare.
Absolutely, absolutely. Um, Bill, I was wondering if you could speak to some of those principles, or maybe what it looks like in the context of the workshop model that you were describing that involved clinicians and public health officials.
Yeah, well, I want to build on what Tara said that
Yeah.
it's about relationships. So our theme is about trust, and trust is inherently a relational idea. And some of it is getting past the idea, the traditional professional idea, that we learn facts, objective, scientific-based facts, and then our job is to transmit them to people who will say, thank you. There was maybe a limited time in which that happened, but we're not in that world now because there is a credibility issue of about expertise everywhere. And so the only way through, as Tara was saying, is through a relational approach. And in fact, what I'll say something that might sound provocative, but policy relevant facts are all based on social trust. Because unless you are a researcher who is exactly on the forefront of a particular area, like of medicine or climate change, whatever, unless you are right in the nexus of that, you are basing your views related to policy on who you trust. Do you trust those researchers? Do you trust the journals that summarize it? Do you trust the news sources? And we have an era now of low social trust across the board. And so what I'm saying, even the facts that we deal with are depend on relationships. To get to shared information, it doesn't come on high. And that's the Superman thing. We don't have any that's another era. Now we have to have the skills for, if you will, negotiating a shared reality. I like to
Mm.
think, for instance, of a diagnosis is a shared meaning or it's meaningless. What does it matter if I have the correct diagnosis in the chart if the patient and I don't have a shared understanding of it? And that comes out of a relationship.
Absolutely. Absolutely. We are going to pick up on this theme here as it relates to relationship and how that shows up, how polarization shows up in our various lives. I do want to pause though and take a moment just to hear from the audience. And I'm wondering if, for everyone in the audience, if you might share in the chat a sentence or, just a few words that describe what you're hearing about polarization, care delivery, and mistrust in healthcare. We're going to pause just for a few seconds to see if some things start coming through in the chat. Might be that we need to give our audience a little bit more time. Oh, there we are. So I'm seeing a few different themes here. Um, just picking up on the issue of how not having trust is a really important barrier to receiving care, that it's ubiquitous, um, lots and lots of negative health impacts related to it. Um, Consequences of the polarization, sort of dealing with picking up the pieces related to that. Um, how we're even seeing the politicization of the polarization. So it seems like our audience is dealing with it in a lot of different contexts. Um, Tara and Bill, what are your thoughts on some of the things that you're seeing coming through here in the chat that our audience is sharing?
One thing I saw that struck me is somebody said they were seeking institutional guidance. And I think that is exactly right. If you're a practitioner, if you're a healthcare provider in an institution where you may have a patient coming in a very different perspective on a health issue, or wearing some symbol that represents something that makes you feel uncomfortable or that even challenges the principles of medicine. That's a terribly uncomfortable position to be in the moment. So there is, as Bill mentioned before, that moment of negotiating some shared reality, which I think is relevant in that moment, but that's on an interpersonal level. But institutionally, I think there are things institutions can and should be doing to help people working in those institutions, whether you're a hospital, a clinic, community center, university. Um, and it does go back to common values in the end, actually. And having the security that as somebody in that institution, you know what those institutional values are. And once I've seen in the organizations I've worked with, the ones that navigate polarization the best have a very clear sense of purpose that is communicated, shared, and reflected upon with people who work there. There's a kind of a non-partisan, and I use that word carefully, but a non-partisan stand in general. It doesn't mean you can't have dissent, but the institution doesn't come into the dialogue with a political position. And there are humanitarian values, which is we're all here to protect lives, to alleviate suffering, and to do what it takes up to a point to try and alleviate the suffering of the person in front of you, separate from their views, separate from your views, but really that core duty in medicine, to care for people. And that is incredibly hard when they don't trust, the patient doesn't trust you, or your peer doesn't trust you, or you disapprove of or feel threatened by the other person. So I think there are some boundaries to that humanitarianism, and I saw it when I worked with Doctors Without Borders, MSF. Those doctors, they will care for anyone. It is their absolute principle. It's their purpose. Both sides, terrorists, everybody. It doesn't mean they won't go away and speak up about what is they've seen that is unjust. It doesn't mean that they won't walk away when there is violence that could impact them. Doctors Without Borders will leave when their facility is being bombed or someone's trying to shoot at them. They do have boundaries, but they're also incredibly courageous. And the institution builds that culture of courage to deal with really taking you to the edge of discomfort, um, so that you can really do the duty of caring for people. So I wish institutions would take some time to come to some agreements with the people who work there around what the boundaries are and what the duties are, and get to a shared point with that.
Absolutely. I'm going to pick up on that, Tara, in just a moment. I'm going to ask if you reflect on some of the individual choices people can make when it comes to responding to polarization, since you've talked about the institutional sort of duty with respect to that. But first, Bill, I wanted to ask you if there was anything that stood out to you of what you were seeing from our audience responses in the chat.
Well, I was just struck with how these issues are everything from individual patient care up to larger social institutions, and I think that's right. It's very complex, and also that I think clinicians in particular, as well as frontline public health professionals, are left to figure it out on their own, and that is not fair. We didn't train people for patient care and frontline public health work when people don't trust them, systematically don't trust them. And there are skills to navigate this, and some of what we try to do in Braver Angels. But I think institutions have a responsibility to help the frontline folks know how to navigate this world, because we're going to burn everybody out.
Yeah. Could you talk a bit more about what some of the skills are for nav or the approach to building skills to navigate
Yeah, I mean, so
this?
one skill that is we teach and is obviously really important is to be willing when a patient disagrees with you about about vaccinations, for example, to inquire about how they came to their view. And so in Braver Angels, we don't ask people so much, why do you think that way? as much as how did you come to this view? How did you come to think of it this way? And they'll tell you a story. And they'll tell you a story about what they read. Somebody mentioned TikTok, about somebody in their family. They'll tell you a story. And in that story will be the sources that they trust. And to acknowledge that, and then to say, if you're a clinician, the sources that you trust. Okay,
Mm.
this is how I come to my view, and some of that is the patients I take care of. It's the resources that I access, and to acknowledge that you're coming to this disagreement with different sources that we trust. Instead of we're coming to this, you're ignorant and I'm smart, and to begin to negotiate that relationally. Excuse me, a lot of patients will start to move towards you if you give them the respect. Another thing I'll just add to that, we can talk more about this later, is that for some things like vaccinations, if the patient goes along with me or with their physician, they may lose friends. They may have family turn on them. And so it's too easy to think of as the patient in front of me. That patient is part of a social circle. And so that's where we have to be thinking about the public health aspect of this and the community conversations, because it can be very difficult for an individual to go home and say, I let them stick me. Okay. And maybe that's going to put a chip in my brain. I feel then maybe if I'm the clinician, I feel good that I persuaded somebody, but they go home and they get this backlash. And so we have to think about the patient in the context of their family and their community as well.
Yeah. Yeah. Great points. Thank you. Tara, I wanted to pick up on that question that I had sort of planted there about how polarization is showing up in the lives of some of the people you're working with and some of the individual choices that they can make around that.
Yeah. I'm trying to think of a good example now. Well, with the food cooperative that I'm working with, which is surprisingly similar to a healthcare organization, the individuals who are facing polarization among the community of members experience fear. Fear of this being something they did not sign up to do, weren't trained to do, feel like there may be death threats, there may be threats from politicians and legislators. And what I feel they need actually is help with conversations about what that feels like and what they can do, which are really different than the conversations they've ever had in their professional lives. And so I am a coach, and I do help facilitate those conversations around sense making, actually, and to say what is going on that you thought that you worked in a food cooperative, or indeed you thought you worked at a medical board, and now you're getting death threats from people that don't agree with something your institution did or isn't doing. Um, so I think that there needs to be psychological support for that, actually, and some skills around difficult conversations, conflict management, de-escalation, and also, and I think Bill alluded to this, but reflection on context. That a lot of the time we do our professional work in more of a bubble, I have done, and feel like we're experts and we learned medicine or we learned agriculture, whatever, and haven't really been given room or recognition that everything, the world is coming to work. Like you're not suddenly in a clinical setting where you have control anymore. Everything, the emotions, the politics, the turbulence, the complexity are all coming to work with you. So again, I think there's a process of resilience building and coming to terms with that reality, that our jobs are different than what we thought they would be. And we also have choices again to walk away from that if we don't feel safe. Choices to this extent we can economically make them. But I think this is what's new, is we don't just need to train people anymore, but we need to collaborate with people on collective coping skills.
Yeah. Yeah. Such important points. Thank you. So I'm going to talk about something that I think everyone can relate to, which is the COVID-19 pandemic. It did reveal some deep fractures in public trust in science and medicine and our government. So what have we learned about the fragility of strength of public trust during the pandemic, and how can we rebuild it across divides? Bill, I'm going to start with you on this one.
Yeah, so here's where I want to strike an additional theme here, and that is humility uh, about the limits of what we know in healthcare and the mistakes that we make. Because if we only relate to this trust gap as we're the innocents here, we're the Superman, Superwoman, right? And but people don't respect us. So there's some soul searching that's going on about how we handled in public health this pandemic. And one of those that I'll specify is really important that I saw early on, and that is if we assume that our area, our healthcare is everything, it's the it's the only value going on. Remember early on, it was like you're talking about the economy and you're talking about schools where people are going to die. And so this is sort of my area is top. And a lot of us are critical of that when we hear people say, no, the economy is first. You know, is the economy stupid or whatever? Okay. And we know that the economy is about people and the health is important. But in some ways, I think we made the same mistake of saying this is about medical, this is about health, this is the only value that really should come to the table. We're going to put you down if you bring other values. And so, among other things, as we go forward, I think some soul searching about how we address these important societal issues like a pandemic as communities, as everybody has a place at the table to articulate their needs and concerns and to figure something out together.
Absolutely. Thank you. Tara, you've some of your recent work has been about transparency, highlighting transparency as a trust building process, and you've spoken about that here today as well. And I wonder if you could talk a bit about how healthcare leaders can use transparency more effectively, especially in crises like the COVID-19 pandemic and
Yeah,
other future
thank
crises.
you. And this definitely relates to some of what Bill was saying around the supremacy of health versus other economic, social issues. Um, but transparency needs to acknowledge uncertainty. And that's one of the big failings, actually, I think, as we look back at the early times of the pandemic, is there are even best practices. Any of you who are on the call who come from public health know what they are. I did research for 2 years with 24 healthcare leaders about the response to the pandemic, including 3 CDC leaders, former CDC leaders. And they actually spoke very well about how to communicate during a crisis, and how you talked about what you know, what you don't know, what you're going to go and find out, and what might change and what to expect. There is a kind of good formula there that was not put to work in 2020, 2021. But that good formula includes transparency about what we don't know, for example, or what we do know. I think there was fear during those years, apart from the political disruption, but there was fear that if we were too transparent, that we would confuse people. And with a patient advocacy background, I would say that was rather patronizing, and that now people are used to being individual decision makers, doing a lot of research and so on. And we want data, we want information, we want to make sense of it ourselves with help of professionals. And then we will decide what's in the best interest of ourselves and our families. And so we want transparent information, even if it's messy, uncertain, unfinished, might change. And sometimes leaders in public health were trying to give us black and white answers to not make us stressed and to make us understand what we all should do. That actually backfires in a world where people are much more individualistic now than they were in previous decades. and they want to make individual choices. So I think there's a lot to learn about how to speak to and respond to the needs of individuals, even if those of us with a public health mindset believe in community and believe in the greater good. That isn't our reality. So thinking about who's out there and what their needs are, and their needs are not only health needs, there's trade-offs for everybody. And my research also sort of surfaced understanding the political, social, economic, cultural context of people is the key to being able to deliver the right messages to people and to collaborate at the community level. And I think that's going to be really important now, where we have an administration that doesn't actually value public health the way that I understand it, is we're going to have to rely much more on a community level response.
Interesting. Yeah. Yeah. Well, Bill, I want to turn to you and wanted to ask if, I guess, what have you learned from Braver Angels healthcare related activities that could inform future policy or community engagement?
Yeah, I think I'd actually like to combine my answer to this with the question you're going to ask later
Okay.
about somebody having a transformative experience. Okay,
Yes.
because we Brave Angels was not in the public health area at all before the pandemic started. Um, but we saw it as this red-blue divide. So that's where we started to, have conversations between liberals and conservatives on this. And then in 2022, I believe it was, we were approached by Francis Collins, who was the head of NIH and Fauci's boss. That way, I always, when I talk to lay people, I say Fauci's boss, and who was in the center of these challenges. And he was stepped down at NIH. He was a science advisor to President Biden, and he wanted to write a memoir, and he wanted to understand what happened where he and so many lost trust, and everything just backfiring. And he talked to David Brooks of the New York Times, who's a friend of Braver Angels, and so Brooks said, "Go talk to Braver Angels." So he called us, some of us, and we designed a series of conversations and relationship building for him that he was willing to do, starting with a truck company manager, former truck driver, now a manager, Wilk Wilkinson from Minnesota, who had a blog that was virulently against what the public health establishment was doing. And and but he was willing to get to know Francis Collins and vice versa. So we designed a series of relationship building activities uh, where they got to know each other, and then through them, other deniers, if you will, to use that term, coming together that he met with. So he actually built a friendship with Will Wilkerson and got to know many of these other folks. And then we brought some other public health folks in. And it was all about understanding and storytelling and getting to know each other and their concerns. And out of that came not an agreement on everything, but but trust. And so Wilk can represent to his constituency that yes, Francis Collins have missed mistakes, but he's a trustworthy guy. He cares. Okay, they made mistakes, but they didn't make it just to boss us around or control our lives, because that's how it felt. They just
Yep.
want to take over our lives. And Francis Collins came to understand more fully the mistakes, okay? But also the values, like the value of autonomy. This is so American, don't mess with me. Don't tell me what to do. Don't patronize me. So he got to understand that better. So those two have gone around the country talking together. And so it's building. And what they're doing is assembling people who are preparing for the next time, that how are we going to pull lots of people together, including skeptics, up front. And so that's both about a transformation. And Francis Collins talks about this transformation he went through relationship building. He hasn't surrendered to scientific principles at all. Okay. But they formed a group of people who are trying to prepare to do a better job in the future.
Wow, that's such an incredible story, an instructive story.
It's funny you mentioned David Brooks. He was one of the people I interviewed for my research on trust during early COVID. I didn't expect him to inspire me, and he actually did through
Mhm.
some thoughtful insights about the needs of people. And um, he made the case to me that helping give people economic stability helps create the conditions for social trust so
Mhm.
that when you have a crisis or disaster, people are more ready to trust the institutions that need to want to help them because those institutions haven't failed them in their everyday lives before that. I thought that was really insightful.
Wow, wow, that is. Well, we are getting close to the point at which we turn this over and ask the audience members for questions. But before we do, wanted to end talking a bit about hope. So, Tara, I'm going to ask you first, in the face of all of these deep divides that we have been talking about, what's giving you hope right now?
One thing that's giving me hope are acts of courageous leadership. I've seen them from actually some philanthropy leaders in recent months, Robert Wood Johnson Foundation, Dr. Richard Besser, John Palfrey at the MacArthur Foundation, Darrell Walker at the Ford Foundation. They are speaking up in light of polarization, and they have legitimacy doing that because polarization is impacting their ability to fulfill their own missions. And I think that's a really clear example of where you can use leadership to defend the purpose of an institution. And I know someone wrote in the comments, remember to return to your mission statements.
Mhm.
So I think they're doing that with courage, actually, because they're standing up in a polarized world. They're not actually doing the middle ground compromise thing. And there's room for that in other contexts, but they're choosing not to because there's an absolute threat to institutions. Um, but that kind of courage I've been in the room for different reasons with some Nobel Peace Prize winners lately, people who've worked with them. And I've noticed the thing they have in common is they don't actually walk away from the polarization. They keep coming back with incredible courage, even sacrifice, risks. It doesn't mean we all have to choose that, but that's what does give me hope is there are people in the world. John Hume in the Northern Ireland crisis is a great example that he he had a vision of peace and nonviolence, and a dream, as he called it. And all the political stuff was horrible and full of disagreement, but he just kept going back and talking to the people that disagreed with him until they figured out the small things they had in common. And they created a patchwork of solutions that was totally clumsy and messy, but managed to deliver on their dream to not have violence in Northern Ireland anymore. And I find that, and there's a book and a talk called The Duty of Hope from someone called Joanne Murphy. It's just been published last week, I think. And that's how this is hope. The duty to keep going back and trying to make progress. And then we can achieve our dream. And it might not quite look as perfect as we want or represent the side we think we're on. But at the end of the day, we work in health. We're human beings. We want to survive. We want to be healthy. We don't want to die. So if we keep engaging with people that share that value, we ought to be able to make progress.
Thank you for that message. Courageous leadership. Bill,
That's
same
that's
question.
that's
What's giving?
beautiful, Sarah. And I'm glad as you started that I decided I'm going to quote Abraham Lincoln because you were so eloquent there. That but we need role models, and you talked about one who doesn't give up. So I'm going to quote a couple of sentences from Abraham Lincoln's address to Congress in 1862, in the depths of the Civil War, when this was pre-Gettysburg, pre the hopes that it was that most people had. And so he said, the dogmas of the quiet past are inadequate to the stormy present. The occasion is piled high with difficulty, and we must rise with the occasion. As our case is new, so we must think anew and act anew. We must disenthrall ourselves, and then we shall save our country.
Wow.
Thank you.
Yeah, powerful words. Thank you. Well, thank you both. So I know that our audience is waiting to ask you some questions as well. So I'm going to ask Randall Dent, who's been monitoring the chat, to see if there are any audience questions.
Yeah, so Erica, there is one from Dan, who said the politicians and many of their followers who complained about being denied the right to make individual health choices during the pandemic are now cheering today's Supreme Court's decision to deny others the right to make individual health choices. So how do you build trust among people who change, whom they trust from moment to moment?
So I'll thank you for that. And what I'll say is that there are inconsistencies in every in both sides in this thing, and that what this person has pointed out is an inconsistency among people on the right. They would not view it that way. And also what I've learned in Braver Angels is that there are complexities and inconsistencies on all sides of these issues. And that if we just drill down on one side's inconsistencies and call that hypocrisy, it begins to get to the point to say we cannot deal with them because they do not deal in good faith. We deal in good faith, they don't. We are consistent, they are not. And so where I don't disagree with what this person said, if we had a politically balanced a group of participants here, the next one, I guarantee, would be somebody on the right nailing an inconsistency from their point of view on the left. And then we just go back and forth and back and forth.
Yeah, I'll just build on that. I think we just have to keep having the conversation everywhere about humanization. And that kind of reframes things because you can litigate who's being consistent and whether policies are fair and so on. But we need to keep talking about what it means to humanize other people. And actually, if sometimes people are trying to dehumanize certain identity groups, and there is consistency in that, if you look at it that way. And so to call people accountable, to respect others' freedom to live healthy, productive life where they thrive, I think we get back on the same page and get them to question their own inconsistencies. Um, the other thing I've seen with social entrepreneurs in places in very brutal regimes in Latin America and Africa is just working around this stuff. Because if we try and keep having the conversation with people that are incredibly ideologically polarized and even violent, we don't solve the problems of people that are in immediate distress. And so, as communities, we might have to spend some years working around the policies and finding community solutions to things in spite of the policies.
And we've learned that and you implied this or said this earlier, Tara, if you start with policies and instead of starting with values and goals and aspirations, you immediately divide. If you start with what kind of, how do we want our Americans here to flourish? What do we want for our children in terms of access to healthcare, to good education? If you start there, you build a sense that nobody wakes up in the morning wanting our children, including trans children, to suffer. So where do we start at a higher level, and then where do we then begin to disagree at the lower level? We have a workshop called Common Ground Workshop in Braver Angels, where we bring together people who are very different on some. The first one we did was with abortion. We brought a group of 8 pro-life and 8 pro-choice folks together for a day. And one of the questions we began with is tell your story about how you got interested in this and what led you to be passionate. And so people humanize each other with the stories. And then what's at the heart of this for you? And so people have listening exercises. And then what happens is after this getting to hear each other at a deeper level, each side goes to a different room and comes up with values, concerns, and policies that they believe and that they think the other side could accept. That the other side could accept. And then they come together and share those and clarify, modify, and then they vote on, and it has to be unanimous. Everybody in the room has to say, yes, I embrace this. They come up with 21 points of agreement after that day. And it values, concerns, and then policies. Okay, so among policies, for example, they all agreed on better access to birth control, better sexuality education in our schools, a better support for the WIC program. So that why would liberals and conservatives be for the WIC program? Because the pro-life folks wanted mothers to feel that they could feed their children and then decide to have their child. So 21 points of agreement. If you don't, if you start with, should Roe v. Wade have been overturned, it all falls apart.
Really instructive. So much more that we all agree on than what divides us. Yeah.
There's another question in the chat. And Matthew, I think you were able to come off mute. Did you want to ask your question?
Sure, I'm happy to. I'm asking the question about apology and the role of apology, both at an individual level, but also at a sort of organizational, institutional type level, public apologies. What do you see as the role there? And in particular, the thing I think many of us are struggling with is the idea that a public health organization should apologize when A, they feel like they did their best, and B, they feel like really the locus of responsibility for the mistrust in public health institutions today is people creating mistrust, right? And sort of the other side has done much worse, not acting in good faith, twisting our words, et cetera, et cetera. And so why should I apologize to try and mitigate mistrust, which maybe I had this much role in building the mistrust, but someone else had this big role in creating the mistrust, and now you're expecting, you don't see them apologize, right? That kind of conversation.
Yeah, Tara, do you want to go first on that?
Yeah, I'll start. I'm sure we both have something to say there. And Bill mentioned earlier, and I wanted to mention as well, the role of humility in all of this. And I think of apologies as related to humility and related to the adaptive skills that we all need as public health people or as leaders to learn constantly. And progress, especially in complex situations, is made through learning. And learning includes failing, and failing means apologizing. So I like the idea of apologizing without getting defensive about it, because you're apologizing for the impact that your actions had on someone else, not about your intentions, right? So I think it's valid to apologize as long as you also talk about what you're going to do next to mitigate the situation happening again, to explain what you're learning, and perhaps to include the people who are wronged in shaping a solution, which brings in the more restorative justice kind of approach, and to not stay up on your pedestal and say whether you're right or wrong or should apologize or not. But the listening process actually that builds trust is restorative and includes the people that feel wronged. And I mean, we know that from patient safety for decades. And I think it's true here too.
Yeah, I agree with that. And thank you, Matthew. It's a great question. And I was chuckling as you asked it because I'm also a couples therapist. And so, granted, I have some small contribution to the problems in a relationship, but you got, like 85. I'll take my 15, but why would I, right? And so the way I think of this, both in couples therapy and beyond, is does each person have a meaningful contribution to the problem? Meaningful. I don't care about percentages, right? But a meaningful contribution. And so you cop to that. Okay. You start there. Um, however, what Taro's saying is it has to be in the context of a process and a set of relationships. Uh, the CEO doing an apology, what does that mean, right? Because the other side is just going to say, well, that's just for PR purposes or something. But in the context of dialogue and relationship, accepting responsibility, not leading with, I'm sorry, but like this is what I can see now in retrospect that I didn't see before. These are some competing values I wasn't emphasizing enough, and I really regret that. Um, it invites people. So when I talked about Francis Collins and Wilk Wilkinson, so Wilk, once Francis Collins said, "Yeah, I really made some mistakes. I had blind spots." Okay, then Wilk could say, and there's a lot of folks on my side who were benefiting from this, who were just agitating for this, against the establishment, and who got into conspiracy stuff. And he said, I was there, okay, and that really hurt our country. The problem, last thing I'll say though, is that the institutions can have a collective voice, whereas the folks who propagated this, they're so dispersed. So there's never going to be an apology from the people who demagogued the pandemic. And so as professionals, we just have to suck that up and do what we do. This is what I say to couples. Don't wait for the other person. If you have something to acknowledge, you go for it. And because you can't control what they're going to say. So I loved your question.
Bill, I wouldn't say no to an apology from social media, titans that also provided the conditions for some of that
That would be nice.
um,
That would be nice.
polarization,
Yeah, yeah, yeah.
but I'm not expecting it.
No, and also you can't expect people to say thank you, because when I've seen Francis Collins publicly acknowledge regrets, then I've seen people just tear at him. You got this MD, PhD, and you should have known better. He just has to suck it up. He did the right thing, and this is leadership. But you can't do it with the expectation a lot of people are going to say, thank you, I forgive you.
I had one more question, but I feel like that was a great place to end. So maybe, Erica, I'll pass it to you to close.
Absolutely. I do want to just say wow and thank you to you both for a really informative conversation today. I learned so many things. I know our audience did as well. I think some themes that really stood out to me were the importance of seeing and elevating the humanity and dignity in everyone that we talk to, and really seeking to understand perspectives and conversation, going into them with humility and with real, authentic curiosity, um, and also being comfortable, especially in the clinician role or in the healthcare leadership role of embracing uncertainty and acknowledging where we are at the edge of our understanding of things. So many really wonderful themes that came out of the discussion today. Thank you both for this conversation.